You're listening to Health Professional Radio. Welcome to the program. I'm your host, Neil Howard. Real glad that you could join us again. Going to be speaking with Dr. Randy Brown. He's joining us here from Teva Pharmaceuticals to talk about symptoms and give us a few tips for managing asthma, especially during allergy season. Welcome to Health Professional Radio, Dr. Brown.
Hi, Neil. Great to be here. Thanks for having me.
Well, thanks for joining. What is your professional area of expertise? Give us a little bit of insight into that and talk about your role there at Teva.
Yeah, absolutely, Neil. I'm a pulmonologist by full training. I have a public health expert background. I've been with Teva for 2 years as its Senior Director of Global Medical Affairs for respiratory disease. A lot of the respiratory disease that we tackle at Teva it includes diseases like asthma and COPD. In fact, Teva is the second leading company in the world providing respiratory medicines to tackle these global concerns. So it's a big job. It's a very enjoyable job, and especially just coming off of World Asthma Day and National Asthma and Allergy Awareness Month, we're proud to do this work.
Well, refresh our memories. What is asthma and who's affected?
Yeah, well, Neil, we have some 300 million folks globally who have asthma. Asthma is a chronic respiratory condition, breathing condition. We know that breathing is important.
Absolutely.
The lungs do a very important job. The lungs are sort of like a tree that's turned upside down, and when those branches of those trees narrow in response to allergies or other irritants, it can give us symptoms which we call asthma. Those symptoms can consist of wheezing, shortness of breath, chest tightness, or cough, and they can occur chronically. We have some 25 to 30 million Americans with asthma. Asthma is the most common chronic disease of childhood. It impacts folks at school, folks at work. It is a big problem, and it can cause hospitalizations, emergency department visits, even death. And so we want to tackle it holistically. We want to tackle it with patients and families, as well as providers, informed as to best practices.
What are the causes? Are there several causes? Is there a genetic component?
No, Neil, there can be genetic cause, but there are hundreds of thousands, if not millions, of folks with asthma who do not have genetic reasons for their asthma. Asthma differs from person to person in terms of its cause, but it impacts quality of life, it impacts day-to-day life, and it can be rather sneaky. Folks can get used to some low-level chronic symptoms, and then before you know it, they're in deep trouble when they least expect it, unable to breathe, and having quite a bit of difficulty managing their day-to-day lives.
Most of us know someone or who have seen someone have an asthma attack or have to live with someone, a classmate, as you said, who had asthma. But during allergy season, it must be a double whammy for someone with asthma.
That's right. Allergies can come at any time of year, but particularly during this time of year, when we have trees in bloom, grasses in bloom, flowers in bloom. Those who are sensitive to those sorts of things can have worsening of their asthma. Not all individuals have allergies as a trigger. For some individuals, it might be an allergy to something that's growing in the ground. For others, it might be an animal exposure, a pet exposure, a dog, a cat. Others, it might be exposure to cigarette smoke in terms of an irritant, changes in weather, exercise. But during allergy season, we do see spikes in emergency room visits and hospitalizations. You're absolutely right. It can definitely be a challenge. And we do have some tips for managing this asthma during allergy season.
Well, give us some of those tips. I'm sure that especially, now tips to managing asthma are like gold.
They are, Neil. First and most importantly, it's important to be aware. A lot of times folks with allergies, where they have nasal congestion, they wake with a stuffy nose or what they call postnasal drip. Mm-hmm. During this season, they might start coughing in addition to having itchy, watery eyes, an itchy nose, etc. They might start having a bit of chest tightness. So it feels as if someone is sitting on their chest, or they might hear a whistling sound, a wheeze coming from their lungs. If those sorts of things start happening on a regular basis, it could happen at night. It could happen as they wake in the morning or as they step outside. The scenarios differ from person to person, but the key is if they start happening, then that's likely an asthma-related condition. And most importantly, what they should do is talk to their healthcare provider about these issues happening. Because if happening on a regular basis, it means that asthma, if that's the cause, that asthma is there. And it also means that it could worsen suddenly when they least expect it. And you want to have a plan ready to prevent the problems, not only to react, but to be proactive in your care of this condition.
Now, I understand that Teva Pharmaceuticals has developed a technology in a family of inhalers known as Digihaler. Is that correct?
That is correct.
How does this work to alleviate these symptoms and facilitate the communication that you say is so important between the patient and their healthcare provider?
Yes. So the Digihaler products are the first line family suite of inhaled medication products. Let me take a step back. We use inhalers, medicines that are delivered directly to that tree, if you will, the lungs, where the problem of asthma lies. We use inhalers about 90% of the time globally to treat asthma-related conditions. It is delivering medicines directly to where asthma causes its chest tightness, its cough, its wheeze, its shortness of breath. We utilize medicines in a reactive fashion called rescue medicines when you're having problems, but we also utilize medicines in a proactive, controlling fashion to prevent the problems from happening in the first place in those who've been diagnosed with asthma. Well, Teva has developed the first integrated inhaler that's Bluetooth capable that allows objective data to be shared, most importantly, with the patient about their use of that medication. And when I say use, it's not only the number of times that they're using it, but how well those medicines are being delivered to the patient with each and every inhalation. And so this is a seamless, integrated technology that utilizes flow sensors and Bluetooth technology that gives patients objective data about their inhaler use. And if the patient chooses to share that data with their healthcare provider, that can help inform treatment decisions through a dialogue with their healthcare professional.
Give us a website where we can learn a lot more about Teva Pharmaceuticals and the Digihaler suite of inhalers, if you would.
Yes. So the website is at digihaler.com, and there you can learn about the reactive release medication indicated for asthma and COPD, the ProAir Digihaler, as well as the maintenance for asthma Digihalers, Air Duo Digihaler, and Armin Air Digihaler. Again, that website is Digihaler, Digihaler.com.
Randy, I appreciate you joining us here on Health Professional Radio, and hopefully we'll get an opportunity to speak again and learn more about Teva Pharmaceuticals.
Anytime, Neil. Really looking forward to it. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Randy Brown. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also hear the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.